I agree with a lot of it. I agree with, of course, people being able to afford health care coverage. I agree with things like allowing somebody to stay on their parents' coverage until they're 26. I agree with making sure that just because somebody has a physical ailment, that they're not denied healthcare coverage. What I see, though, is I see the possibility of an even better system. I see that now this administration, Trump administration, has too easily sabotaged the Affordable Care Act. We see the weakness in that it's very subject to sabotage. It depends on folks signing up in these exchanges. They're not putting any money into really advertising for these exchanges, and the number of people has been falling that are enrolling in these last couple of years. There's a vulnerability there that I believe we can improve upon. And that's why I'd like to see us build our system around Medicare, strengthen it for the people that have it. A good example of how we need to strengthen it is, as I said, mental health care coverage, because it can get stronger than it is right now, or reimbursement rates for rural hospitals. The other thing that I believe is that once we have that base of Medicare that is established as the default, that somebody should be able to have their private health insurance plan if they want it. And that's the case in some of the European countries too, right? Even though they have a system where there's universal health care, if somebody wants to have a supplemental private health insurance plan, they're able to do that. Even the plan that Senator Sanders has put forward, which is the purest Medicare for all plan, allows for certain types of private health insurance, but for essentially elective plastic surgery. It's a very small allowance, right? But there's a nod in that direction, an allowance in that direction. I just think that that should be a bigger allowance.